Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. I wanted to give you another example of a portal that is very useful in chronic diseases and gives you kind of potentially county level information from Medicare data. Center for Medicare Services data is hard to come by, but this is a very good portal to be looking at a handful of conditions, including autism spectrum disorders, which is actually one that is rare to have information to get. So this is looking at state level. This is set to states. That's why. But if you switch to counties, this will quickly then change to each of the county levels within the states. So you can kind of look at the ranking here, and then it seems like the prevalence here remains as state. So that might be something that might want to look into to try to change if you are interested in gathering county level information. So you know that Medicare information does carry chronic condition information. It's just a matter of knowing which ones. We can take a look at another one here, hepatitis, and take a look and see if we can turn this into. So the county ranks are there, and then the state prevalence and then the state to national ratio is available. So anyway, this is a really good dashboard. It gets into the prevalence. Even spending and utilization data is available in terms of chronic diseases and the number of ED visits per 1,000 beneficiaries, and a 30-day readmission rate. So this can provide good information as well, depending on what you're looking for. So this one's a good portal to be looking at if you want to look at the number of chronic conditions is higher. Then you see that there's more states that are involved in this, and so then the per capita spending does increase for Medicare, and all of that is affected. So this is yet another portal that you can look at various conditions, and in that same state kind of assess relationships between multiple variables. So for instance, out of just the conditions that I went over, if somebody has 2 to 3 conditions, or if somebody has even 0 to 1 condition in certain states, and then you can look at the spending and utilization of those same states, or some other variable, and even hepatitis, and then see which ones relate to which. So that's another way that you can kind of create chronic dashboards, chronic diseases dashboards. Now, in this segment of the video, what I'll do is I'm going to look at a state level dashboard, and this is exclusively state level, very interesting information that is contained within some of this dashboard. So I'm going to go ahead and get started here. So this is looking at the whole United States, and looking at how many people have alcohol use comorbidity And so most people with alcohol abuse, 48% actually have five plus other conditions. Now, if that is caused by the alcohol use or if alcohol use was the self-medication route, that is unclear. But ratio to national average, anything higher than the national average is bad. So the higher numbers are actually bad. The redder numbers. When it's at 1, then that's, I guess, not as bad. Pennsylvania, the state I reside in, happens to be at 1. But if we're looking at, so what I'm going to do is, so nationally, of course, cardiovascular disease, hypertension is the highest prevalence. But then if I want to see where my state falls in comparison in terms of chronic diseases, then I'm just going to select Pennsylvania and then look. And so seems like in terms of, and I'm not actually sure why only alcohol abuse comorbidity is here. But this might be because of a selection that's already there. But seems like it matches with the national average, so we're not worried about that. Looking at the chronic condition prevalence, the rate of arthritis in Pennsylvania is a bit higher than the national average, so that is of concern. Atrial fibrillation occurs more often in Pennsylvania than in the rest of the U.S., with prevalence being at 9.47% in Pennsylvania, whereas the national average is at 8.41%. But one that is kind of alarming with Pennsylvania, especially, is hyperlipidemia. And this is all very current 2018 data. And kind of interesting because I have hyperlipidemia as well. And so the hyperlipidemia comorbidities are actually, interestingly, not as high for 5 plus other conditions. Hypertension occurs more highly in Pennsylvania than other areas, and ischemic heart disease slightly higher. So these are the areas to be focusing on. Hyperlipidemia definitely, and looking at hyperlipidemia prevalence, and definitely Pennsylvania flags as an orange state, so higher than the national average. So this is a demonstration. This portion actually is a demonstration of an application of how you would use this incredibly important tool if you were to be comparing state-level chronic disease conditions and their prevalence. Now, there might be a part of you that might still be curious and still want to know a little bit more about the prevalence of certain conditions, but now not on the not on the state region, but on a regional level. So here are all the conditions once more, and some of these are actually a little different than what was covered in the previous dashboard. So one that really jumps out to me is schizophrenia. So I'm gonna, because it's there and I'm interested in mental health, I see that the prevalence of schizophrenia nationally is 2.95%. Now let's take a look at 2 places or 3 places, a couple places here. So let's start with Philly and see what type of schizophrenia rates. So it's about the same rate. Hypertension is a little bit more, hyperlipidemia is a little bit more, and arthritis is more, but we already saw that in Pennsylvania data. Let's take a look at Atlanta now and see the rates, and there are slightly, it's about the same rates of schizophrenia, but hypertension is higher, hyperlipidemia is higher, chronic kidney disease is higher, diabetes is higher. In fact, depression is higher, arthritis is higher. So definitely a lot more red flags. So definitely looking in the Atlanta region. This is there are different areas to be focusing on, and this is looking at all diseases. But if you were to change that to specific diseases, that actually might change. Anyway, so I encourage you to look at the different rates and accordingly understand. Try to try to identify the specific needs in the region that you're interested in studying. And look, it might be at the level of the county, it might be at the level of the state, it might also be at the region of the region. So take your pick, and there's quite a few conditions, disease conditions. So this is one way that you can really hone in and understand not only complex chronic conditions, but also take that and apply it broadly into understanding your patient's social context. Thank you for listening.